Welcome, everyone. Thank you so much for taking your snowy Saturday morning to join us on the Child Care Town Hall, Charting the Path Forward. Before we begin, I just want to go over a few quick things. Please, you are all muted as you have entered the town hall. Please continue to keep your microphones muted. Only those who are speaking will be able to unmute. And as we progress through the town hall, I'll give you a brief overview of our agenda. We are going to begin with our distinguished speakers that you all have come to hear, and they will be sharing, their ideas, their thoughts, where they think we need to go, where we need to take childcare to help this most essential sector. Once the speakers have shared their insights with us and their ideas, I am going to open it up so that some of our participants can share their ideas, their stories, their personal experiences struggling trying to get childcare slots or afford childcare in Maryland. And then we will wrap things up. So without further ado, I would like to begin by—
Maureen, introduce yourself, Maureen.
I'm sorry. Yes, my name is Maureen O'Prey, and I'm a public relations manager with the Comptroller of Maryland. And without further ado, I would actually like to turn this town hall over to the man of the hour, Comptroller Peter Franchot, who I'm sure you're all familiar with, and quite the champion of the childcare industry. Sir?
Maureen, thank you very much. And I really want to thank Pam Queen and Chris Push, Delegate Pam Queen, because of her leadership and advocacy on this issue, but Chris, because she's the executive director of the Maryland State Child Care Association and is an unbelievable advocate. And Carolina Reyes and Ruby Daniels, two child care providers in Maryland who will have very interesting testimony to give us, along with everyone else, frankly, who's on the call, because this is the #1 issue for many, many, many Marylanders. I know we're always concerned about the vaccinations because that's so important. And there are a million Marylanders who currently are not fully vaccinated. So that's a key issue, that public health issue. But when you say, well, what's the second most important priority? They say childcare, lack of, too expensive, can't get a spot, can't get back to work because I don't know what to do with my kids. And so we have a really important responsibility. That's why I'm delighted Delegate Queen is with us, because the legislature is going to be looking at this issue. And we have to somehow think very, very forward thinking about how we can change this situation, because the pandemic has glaringly proven that there's something missing in our child care regulation and oversight and government support. But let me thank everybody for taking part of their Saturday to plan on how the state can better fund childcare. It's not just funding, it's also what is the government structure and how they provide, better government delivery of services to this critical sector in our economic recovery. COVID's taught us many lessons in the last 2 years. It highlighted a number of unsung groups whose jobs are indispensable to day-to-day society, including, and very importantly, our childcare workers. In the beginning of the pandemic, it was childcare workers who allowed our medical professionals, frontline workers, and essential personnel to keep our nation and our state functioning throughout the crisis. And it was childcare workers who had to juggle keeping their businesses open to allow others to work, paying their staff, making sure everyone, especially our children, were safe from COVID-19. Unfortunately, it was the childcare workers and owners that took major financial hits from the economic effects of the pandemic. The Maryland State Child Care Association tells us that prior to the COVID-19 pandemic, Maryland had nearly 8,000 child care providers, largely women-owned and minority-owned, for-profit small businesses, very important to our state's economy, as well as taking care of our children. Since then, we've lost roughly 10%, 800 of those wonderful small businesses have closed due to increased expenses, decreased enrollment, critical staffing shortages, and an inability to meet payroll with reduced income. All the time with hundreds of millions of dollars of federal and state relief sitting in state bank accounts, sitting month after month, unallocated, undelivered. And it didn't help that problem with state and federal assistance that flowed through the Maryland State Department of Education, forced providers, because they couldn't get what was promised them. The providers had to exhaust their own reserve funds, dip into personal savings to keep paying staff and to provide care for children of essential workers. In 35 years of public service, for me personally, this is the worst example of government failure I've ever seen. And I find that unacceptable for such a critical job sector in Maryland. We must provide immediate financial support to our child care industry. I think you're going to see a lot of that. Delegate Queen is going to lead the battle. Governor Hogan is open, I believe. But without reliable, accessible, affordable child care, structurally, after the initial recovery, we're still going to be stunting our state's economy if we don't deal with this issue. The good news is that we have an opportunity to help the child care providers. This call is going to help that. Through December's Board of Revenue estimates, the September estimates, and the fiscal year 2022 closeout, the state of Maryland's in an unprecedented fiscal position, positive. We have nearly $6 billion in unexpected revenue. Most of this money is tax revenue, collected as a direct result of the billions of federal and state dollars in stimulus funds. It's a once-in-a-lifetime $6 billion surplus. I believe there's a $500 million portion of that surplus that should be set aside for our child care industry. It's that important a sector. We can use the money to incentivize shuttered operators to reopen and allow them to hire qualified staff at higher wages. We can also follow the federal government's lead by subsidizing the cost of child care for families that can't afford it. Now is the time to get them the help that they need and deserve. Let me turn it back over to Maureen O'Prey, who's done such a good job organizing this and emceeing it. And I just want to say this town hall that we've got organized today is incredibly important to resolving this problem. Thank you, Maureen.
Thank you, sir. I could not agree more. Now I would like to turn it over to another distinguished speaker that we're lucky enough to have with us today, Delegate Pam Queen. She is from District 14, and she has some legislation that will be just one of the linchpins that we need to help this childcare industry. Delegate Queen.
Well, good morning, and thank you for the opportunity to meet with you this morning and to talk about such an important issue to me and to many of our delegates in the Maryland General Assembly, and something that we really need to do to get our economy working. And so as I talk about the legislation we have, I just wanted to provide some background. You know, my other job is a teacher, and so I always like to make sure we understand why we're doing things and why it's important to do things now. One of the quotes that I want to mention that I think really is fundamental into why we need to get childcare resolved so we can get women back to work is a quote from the former International Monetary Fund chief, Christine Lagarde, that says, "When women do better, economies do better." And so we all know that COVID-19, the pandemic, has affected women's employment disproportionately than it has men. And we have a term, we call it the she session. Women are 19% more at risk than men of leaving the workforce due to COVID-19. We're losing even more of the parity that we had in pay and benefits. I wanted to start to talk about some of the legislative actions that we're going to focus on for the 2022 General Assembly. So Speaker Jones is going to have a package related to child care. She's working with Delegate Jared Solomon and others, the Economic Stability Work Group that I co-chair with Delegate Mike McKay. We're all focusing on some element of child care support. And so the policies that you'll see us looking at will be increasing state-funded provisions for child care and tax policies that encourage both parents to work, implementing family-friendly policies that include some flexibility and part-time working hours that support families that have seen an increase in childcare responsibilities due to the pandemic. Developing a professionalized childcare industry where we can have public finance funding to support that. So that will enable many women to work, but also create employment for others. And making sure that we implement special women-owned enterprises. We know, as was mentioned by the Comptroller, that women are many of the workers who run the child care facilities. And so they need stimulus and programs to help them in their economic growth. I actually have a bill coming up next week, HB 89, that talks about providing grants and subsidies to support women as they expand their child care facilities. But most importantly, we have to change the social norms about the value and importance of childcare, as it is a vital need for us, and that the people who provide, mostly women, are essential professional workers that need to be our main focus. They are the main ingredient, not just an added entity. And so we want to leave you with the focus that when women do better, economies do better. And that will be our focus for the 2022 Maryland General Assembly. Thank you.
Thank you, Delegate Queen. And we're very much looking forward to seeing how this goes and generating a lot of support for these bills. What I'd like to do now is have you all hear from Chris Push, who is the head of the Maryland State Child Care Association, and hear from her what her child care providers are experiencing and what she thinks we all need to do to come together to really make a difference and help these essential workers. Chris? Go ahead and unmute, Chris.
Okay, can you hear me now? The host has to unmute me. Thank you so much. And thank you both to the Comptroller and to Delegate Queen. They both have been amazing leaders and supportive of the child care industry before, during, and I know after this global pandemic, the COVID-19. But I wanted to make sure to say that Delegate Queen also provided a citation through the Women's Legislative Caucus to the child care industry. And we just appreciate all of her efforts as she chairs the child care portion of that important legislative caucus. So again, thank you for that. And I can't thank again the Comptroller enough. His op-ed and his recommendations and his unwavering support to the child care community, how he understands and how dollars are spent and oversees and audits and reports on financial status of Maryland on behalf of all of us, the taxpayers. His expert recommendation to use a portion of the $6 billion surplus of $500 million will make a big difference in the work that the legislature does and that we can do together. So I will be thanking the governor for his $50 million that we did write letters and ask for, as they gave the restaurants money in our state from state funds, but not us. And so we asked Secretary Brinkley and the governor's office and DBM to please consider that and to consider additional funds for the child care scholarship subsidy program for our most vulnerable children, families, and we received another $10 million in that state budget, which is good news as well. So there's lots of work behind the scenes and in front of the scenes on behalf of children, families, and the child care industry. So, and thanking them, we also work with Chris Van Hollen's office. So there's a lot of wonderful advocates and leaders that really do understand this and want to move forward. And that's why we're here at this town hall to move forward. But I want to make sure that I thank those of you on here that are the backbone of our economy, our childcare, essential childcare business owners and workers and teachers. The biggest thanks are to you. You are the workforce behind the workforce. You've been a constant support. And I don't know where not only this state, but our country would be without our childcare industry. Childcare is an industry of private businesses providing a public good. The COVID pandemic has reinforced the essential role of childcare and early learning for children, working families, and the economy. Emergency federal funds have been provided for critical support for stabilizing childcare programs and preventing more widespread permanent program closures, but they do not address the systemic challenges that have plagued the childcare market, parents and providers alike, for decades. As such, they are just the beginning of what is needed to recover and rebuild. Even before the pandemic, many providers struggle to meet basic needs. Childcare workers on average make less nationally than $12 an hour. And in our state, we know that child care center teachers make about $26,054 annually. An aide in a center-based child care makes $18,183. A family childcare provider makes $40,000 and $40,374, and a childcare director makes $41,000. And we are struggling to have a workforce. We are in a critical workforce shortage across the country as well. But our wages are a huge issue. According to the Economic Policy Institute, far less than they can earn working. Childcare workers are making far less than they can earn at Target, Starbucks, Kohl's, fast food restaurants, and our work is much more highly skilled than that. Workers also tend to lack benefits, health insurance, family leave, and paid sick leave. Enrollment decreased significantly since the pandemic and has never fully recovered. In addition to the PPP loans, the providers dipped into their own savings, as the comptroller said. The credit cards, they've been just trying to survive. With the additional CDC guidance and many things that we've had to do above and beyond other businesses. The Maryland State Department of Education states that more than 97% of Maryland childcare programs have reopened. It's probably a little more than that now, but that number grossly obscures the reality of the providers are experiencing, because with the last ARPA grants, not the previous ARPA grant, the 44% of the programs that have reopened in Maryland are operating under 50% capacity. So they started prior to the pandemic, and yet the fixed costs remain the same. Other expenses have skyrocketed. Our inflation is up close to 10%. And we have lost, as the comptroller said, over 755 childcare programs since the pandemic, which is approximately 10%. MSD, and that decline is also not just the program itself that's closed, but as I said, classrooms cannot be reopened, even if the program is open, because there are critical workforce shortages. We went from 7,944 businesses to 7,191 and declining. The current blueprint legislation related to expansion of public pre-K will further impact closures without a true equitable mixed delivery system that would have unintended consequences, including less access for infants and toddler care and less affordable care options for families of our youngest learners. And the wide-scale closures of private options could cause massive shortages that already exist in childcare deserts across the country. Many private providers deliver wraparound care services to school-age children, and that would impact families of, and all of this impacts children and families of all ages. Program closures and childcare shortages would negatively impact the economy, as Delegate Queen was stating, and it's important that we're looking at all aspects of this, and labor and commerce as well. As industry jobs are lost, both providers and educators and parents are forced to drop out of the workforce due to the lack of adequate care options, primarily women that are suffering from this. They are being less productive without affordable and consistent quality childcare, and they are also losing out on promotions and such. There's a lot of that goes into the consideration. According to the Center for American Progress, a lack of childcare negatively affected communities of color before the pandemic, and parents of color were more likely than their non-Hispanic white counterparts to experience childcare related to job disruptions that could impact their families' finances. If policymakers fail to act, these disparities, this crisis, will only intensify. We are grateful that our congressmen, our champions, our legislature, and a governor's office has taken some actions, and the comptroller has suggested we use our surplus to make an even more significant investment in different ways. Child care is a unique business. I'm just reminding everyone that the federal government has provided states with pandemic-related child care relief as they recognize the impact and the unique challenges that the vulnerable child care industry faces as tuition-dependent small businesses, primarily owned and operated by women. Federal funds for stabilization and rescue efforts for the child care industry have been life-saving for many, and more support is needed. The majority of child care expenses are fixed. They can't operate any part of their business remotely. They cannot automate or change practices to adjust, and they must maintain adherence to strict regulation in COMAR and teacher-to-child ratios. And it is a top 3 household expense. Child care, we cannot raise tuition. That's a last resort. It's simply untenable for most providers. We don't want to do that. So our areas to address, as Maureen said, we need to be very concerned about the urgency that the child care grants that we do have available and that are coming in the future, we hope, are considered urgent and that are expedient, transparent, and efficient. Our critical workforce shortages and workforce development barriers are lifted, and that our child care scholarship and subsidy program and system is working properly, and that the bills that, as Delegate Queen mentioned, are coming forward, that is backed by our House Speaker Adrian Jones, will be something that will improve the ability for families to access childcare. And so there is, I wanted to quote, I want to tell you how some people use the grant monies that they have so far. I thought it would be a good idea. And I think this person is actually on the call, but Lisa Herbst, who owns two childcare programs, and she also has childcare expansion grants. She has used her money to increase her pay scale by 20% to fill 14 staff positions in 2 center locations. She had to because people could go to Kohl's or McDonald's or Sam's Club for jobs. She is competing for a few people that are willing to and able to work. I don't know how long she doesn't know how long she'll be able to sustain salaries, but ultimately she wants to be able to pay employees what they deserve. It's critical considering the requirements of the job. This is a highly skilled workforce. It's required being aware of growth and development. It requires being aware of social and emotional development, cognitive development, and physical development. And it requires having a lot of physical energy and stamina. We need to remember that 90% of the brain development, the work that you do of a child's brain, that happens before the age of 5. This is extremely important work that we're doing. And we're glad to be recognized and have these types of town hall forums to make sure that this is known. So some of the things that I think, besides HVL 89, which we will be proudly supporting next week, there are a package of other bills that we look forward to supporting. We ask for your support as well. As Delegate Queen already mentioned, Delegates Jared Solomon and Senator King, Delegate Eversole, Delegate Kelly. There's a number of bills that will be coming up. Some of those are based on the one is called Early Childhood Childcare Alterations Bill, which will allow presumptive eligibility for families to be part of the Child Care Scholarship Program, because now it's taking so long to provide the paperwork and process it that they're not able to get to work and back to work, and we need that. There will be the bill also has a component of it that requires 10 days after receiving an invoice that the child care provider will be paid. So these are all legislative efforts that are really important to your business and that we need to support together and stand behind these leaders and champions in our legislature to make sure this happens. There's additional bills that have to do with child care revolving loans established just for child care businesses. As Delegate Queen said, there's a number of tax bills that will be introduced that will support women and small business. And so I just want to be sure that we are addressing, our most important issues that continue to plague us during and that will continue after we get through this pandemic. One thing I did want to mention is that we serve a population that isn't eligible for child vaccines. So children 0 to 5 don't have opportunity for vaccines. And so this is very difficult to find staff and to keep staff, especially if they're older or have any underlying conditions. So we are really working hard to be there for our families and our communities. And so I'm going to put in the chat how you can contact your legislator. So you'll be able to do that. And we'll send that out as a follow-up as well, because your voice does matter. And I want you to know that we are hosting more town halls together with leaders. Next week, we'll have one on child care scholarships on February 5th or 8th. So be sure to join us and we'll have more opportunity for you to to register for that. And I just wanted to mention as I close out that we must meet or exceed national recommendations for childcare, especially with reimbursement rates for childcare scholarships, which the recommendations at the 75th percentile. MSCCA, MFN, and champions in our legislature and public policy advocates have worked tirelessly to move Maryland from the lowest reimbursement rates at 9% just a few years ago to the 60th percentile last year. And then currently pushing a path forward due to a lot of advocacy on everyone's effort that it has been raised to the 70th percentile, which is amazing. We're getting much closer to this national recommendations. So advocacy and your voice matters, our work matters. And I want to thank, again, the governor for the $50 million and the $10 million. There also will be significant investments in eligibility, increasing eligibility for families to be able to get their child's first scholarship, which is so important that we are able to meet the needs of more families in Maryland. And I recommend additionally advocacy on using a realistic cost of care modeling and not a market rate survey to really determine the true cost of care, of quality care. That data is necessary for everyone in leadership to make decisions, budget and otherwise. And we just need to realize that One other thing about the health and safety of our children, we are the only industry that I'm aware of at all that is forced to shut down or close our full business or our classrooms for one exposure to child COVID-19. So one child or one staff person. And we have to call the health department, which we're happy to do. We notify parents, we're happy to do it. But we are the only industry that has to close fully. And that means if you have a classroom of 20, 19 other children can't come back and their parents have to find alternative care when the schools and other businesses are excluding the child or the staff member. And that's what we should be doing, excluding them, making sure they have tests to come back, making sure they're quarantined long enough. But really, this is a huge problem because we need more money from you from everywhere because we don't want parents to pay while we're quarantining for 2, 4, 6 weeks. It becomes a domino effect, and it has really impacted our community even further with the Omicron and the contagiousness of that particular less dangerous but contagious variant. And so as a co-chair of the Opposite Child Care Advisory Council, as a member of the State Early Childhood Advisory Council, as a member, as my board is members of many local early childhood advisory councils, MSCCA is fully engaged with partners, decision makers, and will continue to work proudly to represent the essential, important professionals in our field. Thank you for all you do for children and families in Maryland. And you'll hear from some of our members and experts now in our field.
Thank you so much, Chris. We appreciate you really getting into the details of what's been going on, what's positive that's happened, but also how we can do more to make sure that we are taking care of our essential childcare workers. But what I'd like to do now is turn it over to Carolina Reyes. Carolina is the director of Arco Iris Bilingual Child Care Center, and she is here to share with both our Spanish speakers and our English speakers that are on the call her thoughts and her experiences as a child care provider in Maryland. So Carolina, please take it away. Thank you.
Buenos días. Good morning, everyone. Thank you so much for letting me be here. Primero me quiero comunicar con la comunidad latina para mis hermosas compañeras que trabajan en esta educación infantil hermosa que provee tanto para nuestra comunidad y para las familias que están aquí. Hoy se nos da la oportunidad de alzar nuestras voces de por qué nuestro gobierno del estado de Maryland puede invertir en la educación infantil. Good morning, Comptroller Franchot, my fellow early childhood community colleagues, my families and childcare teachers. I first want to thank you for giving me and my colleagues the opportunity to speak out today. As we learned today, Maryland has a significant surplus of money, and this is why I'm here, to stress the need of investing in high-quality childcare for Maryland's children. The prime importance of childcare community in supporting the economy of our state, and how central we are with providing a strong foundation for our children before entering kindergarten. I am a proud Latina immigrant and the owner and director of Arco Iris Bilingual Children's Centers in Laurel, located in Prince George's County, serving diverse and hardworking families from different counties. I serve Prince George County, Montgomery, Howard, and Anne Arundel. The pandemic has brought many burdens upon the childcare industry. For instance, my center was forced to relocate in the middle of the pandemic, but with the help of friends, family, and MSDE leadership after reaching out to them, I managed to reopen. You may ask, why did you close and reopen in the middle of the pandemic? Well, I had to close because the previous property owner had their own economic issues due to the pandemic, and we were forced out. Finding a new location was daunting, costly, and a real struggle with getting all the permits and the licensing paperwork done in time. Because I feel so strongly about offering childcare for my community, I chose to go through this process. Providing early childhood education is a passion for me, not simply a job. My center is now operating at less than 50% capacity because of having to close and relocate and families not having enough money to enroll their children into childcare. The grant money that I obtained has helped me to keep us afloat until today. So yes, we still need grant money to maintain our small business viable. Wages and rent are the most costly expenses in childcare, especially when you want to pay decent wages to your teachers. We are rebuilding our economy and we must do it right by providing childcare scholarship for working families quicker and in a much more efficient manner. We must reduce the application process because it currently takes about a month and is extremely user unfriendly. By doing so, this will benefit working families enormously. There should be a statewide campaign to inform our Maryland families about the essential resources available to them. Our families do not know about the childcare scholarships. So please let them know about this benefit. I must not forget to mention the crisis many of my colleagues are facing. We are often unable to attract and keep teachers in the field. Why does this happen? If you ask me, it is because childcare teachers are not respected as a profession in our society. We are often seen as only babysitters. I can assure you, we are not. I have not been doing this alone during this hard time. My team, my colleagues, mis maestras, and my childcare teachers have been important in ensuring the success of quality early childhood education. So yes, we need money so that we may offer them liable wages, benefits, and equitable pathway for higher education. This must also include the diverse and multilingual teachers in the childcare community. Tenemos que incluir a nuestros emigrantes, a ellos que no hablan el idioma. They must not be left behind simply because they may lack English proficiency. To conclude, we need this money. We need this $500 million to improve and rebuild early childhood education, an education that must start at birth. Our Maryland children, families, teachers, and childcare centers need this support. I strongly believe that Maryland is working hard in being one of the first states in creating a strong, inclusive, and equitable early childhood education system. But do not forget to embrace and lift the childcare community in the process. Thank you for the opportunity to represent many of my colleagues, families, and the teachers today. Gracias por darme la oportunidad de representar a muchos de mis colegas, a mis familias y a las maestras hoy día. Working together, we can achieve great things. Trabajando juntos, podemos lograr muchas cosas. Thank you. Gracias.
Thank you, Carolina. So well said, beautifully put, and in both languages, and we love it. That's going to get us motivated, but we're not done yet. We've got one more distinguished speaker we would like to hear from, and that is Ruby Daniels. She is the head of the Maryland State Family Child Care Association, and she would like to provide some of her insights. Ruby?
Thank you so much, Maureen. Can you hear me? Hello, everyone. My name is Ruby Daniels. I'm the president of the Maryland State Family Child Care Association, representing
Ruby?
nearly 4,500.
Sorry to interrupt, Ruby. Your microphone is picking up some paper or movement. If you can hold it steady, that would be great. Thank you.
Sorry.
Okay.
President of the Maryland State Family Child Care Association, representing nearly 4,500 family child care providers in Maryland. I'm honored to be here with you and thankful to Comptroller Franchot, Delegate Queen, Chris, and all the family childcare providers and everyone on this call for giving me the opportunity to speak on behalf of the family childcare providers. We're also thankful to MSDE, our State Superintendent Chowdhury, and the Comptroller's Office for streamlining the grant application process and for expediting the grant payments. I've been hearing from my members that they have received their grants and how the Comptroller's Office had been helpful in giving them information. We are grateful. The grants has helped us a lot, but more help is needed. Family childcare has been impacted by the pandemic, just like the rest of the childcare industry, just like what Carolina said and what Chris said. But it's even worse because our unique structure. We operate in our home with a ratio of 1:8. Some, like myself, have a full-time employee, which translates to a ratio of 2:8 or 1:4, leaving us with a thin profit margin if we are full. Most of the time we're not. Our enrollment varies and fluctuates, to make matters worse because we have working parents that are changing jobs and moving to a more affordable housing option. Some even move in with their parents or vice versa. There are some things that affect our business. One of them is the timely payment from the state in terms of the childcare scholarship. My members have reported that payments slowed down considerably in 2020. Consequences of the late payment has been the inability of family childcare providers to pay their bills on time, causing more difficulties for programs to stay afloat. I've been hearing from providers that they have to let families go because of months of waiting for a childcare voucher. Sometimes we do have to absorb the costs if they're unable to pay. On top of that, when the provider tests positive, just like what Chris said, we have to close down for weeks. And in some cases, if there's a repeated infection, some programs could close down for a month or more than 2 months. Oftentimes, some programs have to again absorb the costs. Grants are great and we are grateful, but we need more support in order for childcare to make it through this difficult time. We're grateful that our champions on this call, Delegate Queen, for all the childcare bills that she's presenting this session, Delegate Solomon, Delegate Kelly, Senator King, Senator Washington. There's so many of them. I can't even mention all of them, but they are our two champions. And of course, Chris Push for also helping family childcare providers, even if she's not a family childcare herself. And Carolina, we're grateful for all these partnership and that we have a unified voice. I look forward to our collaboration so we can help the childcare industry, the families, and the children of Maryland. Thank you so much for giving me this opportunity. Appreciate it. Have a good one.
Thank you, Ruby. That was well said, and another call to action here that we're getting towards. The first thing I'd like to do, though, before we move on to the calls to action, is get an opportunity to hear from some of the participants that we've had that have been on this call since the beginning today. And one, I believe, we have from the YMCA, and I don't know how many of you are familiar with the YMCA. They do also offer childcare programs, both after school, before school, and summer camps. And they would like to offer their perspective. And we have with us today the Chief Strategy Officer, Derryck Fletcher. Derryck, if you wouldn't mind saying a few words.
Sure. Thanks, Maureen. Good morning, everybody. And special thanks to Comptroller Franchot, Delegate Queen, and to everyone who's working so hard to champion the great work that we do. I work specifically for the Y in Central Maryland. I also support the Maryland State Alliance of YMCAs, and collectively, we are proud to support and engage students, youth, and families across we call it the cradle to career continuum. And we have great scale, and we're able to do this in communities across the state of Maryland. One of the great things that Chris mentioned during her remarks, as well as the remarks of those who followed her, were some innovative and real common sense strategies and innovations that we can use to support the childcare industry. And so we won't use our time this morning to repeat any of those, but we would like to be very clear that we very much agree and are aligned with all of the recommendations that were presented this morning by Chris and the State Child Care Alliance. We would, however, like to add to the list some specific recommendations and considerations for school-age childcare. While there has been much advocacy and much work around the state and how we invest in our workforce and we stabilize the childcare industry, specifically looking at the early childhood age range, what we know is that care and engagement, enrichment opportunities for school-age children presents a significant challenge. According to the Maryland Out of School Time Network, from 2014 to 2020, the percentage of Maryland's young people who would have attended an after-school program if one were available, rose from 36% to 48%. Nearly 60% of all Marylanders say that after-school programs are too expensive for their children. What we know is that demand for after-school care is at its highest amongst families of color, who are more likely to report that enough opportunities are not available in their communities, and that those opportunities that may be available are likely unaffordable. One of the Maryland Chamber of Commerce's top priorities for 2022 is championing legislation that incentivizes the opening of new childcare facilities and the expansions of existing ones. What we like to specifically focus on is the impact of the impact on our economy and the impact on working families of not having affordable childcare opportunities for their school-age children. Maryland's after-school childcare regulations often fail to incentivize the operation of safe and affordable programs because they are outdated, they are overbroad, and they are also inconsistent. What many may not realize is that while summer camp opportunities and programs are also regulated by regulations that are noted in COMAR, there are a different set of regulations for summer programs than they are for school year after school programs. And they're also regulated and managed by two different state agencies. The Maryland Department of Health regulates or manages and enforces the regulations for summer programs for school-age youth, while the Office of Child Care and the Maryland State Department of Education enforces the regulations for school-age care during after-school programs. And those regulations are not aligned and not consistent in terms of staffing qualifications. And so that really inhibits the industry's ability to create and build and sustain a long-term workforce that engages school-age youth year-round. And so in addition to that, one of the other barriers is that the child care regulations for school-age care programs, many of which happen in school buildings, often exceed the regulations or the physical plant expectations that local school districts have to adhere to. And so what we find is that operators of school-age childcare programs are responsible for chasing down things like boiler inspections, fire inspections, and things like that. And for school cafeterias and in spaces where students have been engaged all day during the school day. And so it creates an overly laborious process that one begins to exclude smaller providers who don't have the scope and scale to be able to manage those administrative requirements. And then for larger providers like the Y, who can build in that scope and scale, it adds costs, fixed costs that are often then passed along to consumers, working families who can't afford these opportunities and are then left to decide whether or not parents don't return to work or their children are forced to be latchkey kids and be in situations and environments that may not be safe for them. And so if we cut across the grass, there are two pretty easy solutions to the problems that we've lifted up, or the challenges that we've outlined today. We can address the duplicative and laborious actions that are required by school-based before and after school programs as it relates to the physical plant and equipment regulations by just allowing those programs that operate in public school buildings to be assumed compliant. If they're in a public school building, one would presume that LEA is ensuring that their students are operating in a safe space during the school day. There then would not be reason for the hardworking staff in the Office of Child Care at the State Department of Education to have to enforce additional regulations on those child care providers. Additionally, we can alleviate the onerous staffing requirements that are not necessarily aligned with evidence-based out-of-school time enrichment program quality standards for school-age youth by simply aligning the staffing requirements for school-age childcare staff with those of day camp staff for the summer. Obviously, the Y and many other providers are able to provide safe summer enrichment opportunities for hundreds of thousands of youth every summer, and we're able to do that in a safe and reliable and an enriching way. We like to be able to take that expand that workforce and build a year-round workforce by being able to offer affordable, safe, and enriching options for families during the school year as well.
I wanted to mention something that I wanted Delegate Queen to maybe address. There was a comment earlier. I've been watching the comments, but one of those comments was about using, this is pertaining to your legislation, Madam Delegate. Some of the money should be used for scholarships at Anne Arundel Community College's Early Childhood Program, which certifies people in childcare. So maybe if Delegate Queen wanted to talk for a second about, or maybe even Chris, the need to certify people more efficiently or to expand scholarships for those who want to become certified in childcare. And if anyone else has a question that's good for the universal audience here before we wrap up in a few minutes, go ahead and type that in the chat. For those of you who had individual questions about payments or anything like that, at the beginning of this chat, I mentioned both Maureen and I's email, but my email is sobrien@marylandtaxes.gov. So if you have any questions about payments or vendor payments or any confusion you've been having with your sort of bureaucratic end of your childcare, you can certainly email Maureen or I, and we will help you get your answers. So again, it's sobrien@marylandtaxes.gov.
I'll just mention that you asked about the retention and recruitment bonuses. I think you were talking about in the chat question. So I know Delegate Queen can answer that if you send it to her staffer with her bill. And there is another bill that addresses retention and recruitment bonuses that will be anyone that's part of the credentialing at level 1 or higher in childcare will be able to receive additional bonuses on top of what bonuses they would receive in participating in that program. So that's a bill that's coming out as well. And to Derrick's point, I put in the chat that there was, and from legislation the previous year, a work group that was put together to work on school age regs, and there was a lot of recommendations that were made to revamp those. And I don't know where they, I know MSD is working on possibly those regulatory changes that they feel they could meet at this point, or else you'd have to move through, another legislative process. But I did want to mention that. One thing I did want to ask the Comptroller or Susan, a lot of questions that we do get, and Ruby can, comply with this as well, is that when we get these grants, which are amazing and keeping us in business, there are tax implications, right? And we need tax credit, we need tax relief, because this is income. So when you have the taxes, and I'm sure you can end on this, Comptroller Franchot, it's important for us to understand that liability and what that means for us and how to offset those tax, issues as a business. So I'll end with, we're here and we're listening, and if you want to contact me as well, I'll put my information in the chat, but we really appreciate all you're doing. And Pam, I think Delegate Queen's on here, so if she wants to mention her bill, yes, which also speaks to that.
So I'm going to just say one thing before I turn it over to Delegate Queen, because she still is on the call. The Comptroller did decide to extend the tax deadline to July 15th for individual income tax, which is the way a lot of these child care providers do pay their taxes as business owners. So that would apply to them. And again, if you're having issues paying taxes, you have to communicate with us and we can work out payment plans. But go ahead, Delegate Queen, we'll let Comptroller Franchot end the call. So Delegate Queen, if you wanted to say anything.
I'll just say quickly, I am monitoring the chat, so I do have those questions.
good.
We are going to be looking at the, and I'll reach out regarding the certification. That's not currently in my bill. We have some other things that are looking at that issue. So, but we know that's an issue and we're trying to find a way to cover that.
Thank you, Delegate Queen. And at this point, I'd like to ask, while Delegate Queen is on, I'd like to ask her, what is her call to action for all of the listeners that are on this call now? How can they help?
Okay, I'm unmuted this time. So we really can use your advocacy. Again, if you have, as you follow these bills, when we can make sure you know that they're coming up, make sure that you are sending in letters of support. If you want to come and testify, that will be very helpful as well. Just making sure we keep the pressure on about knowing that this is an important thing for us to do. We do have the support, as I said, at the House Speaker, so we know it's important. So we just have to make sure that we can get it passed out of our committees and off the floor. And so, and hopefully we won't have a governor that will veto the bill. So just keep on the pressure and advocate and just stay informed. And we are here to support. Let us know what we need to do. Thanks.
Thank you, Delegate Queen. And now I'd like to turn it back over to Comptroller Peter Franchot and let us know what your call to action is, sir.
Thank you, Maureen. I appreciate it. Let me give everyone my personal cell phone number if you want to write it down. Rarely does a statewide elected official do that, but if you have a single state employee that does not treat you with respect and responsiveness and results, I'd like to hear about it. So my personal cell is 301 area code 332-1961. Not all government is like that. When we finally pried away from the cold hands of the Maryland Department of Education, the taxpayers' money that had been designated to your wonderful sector, months of advocacy to pry it out of the state agency. We distributed $211 million to 8,000 grantees within 24 hours. So not all government is slow on the uptake as far as friendliness to our wonderful small businesses, but everybody in the state. But I think the problem here, and I think Delegate Queen and others are aware of this, is that we need to do something about the agencies that are over-regulating and underperforming as far as getting in the way of this sector. And I was particularly interested in local regulations and local, health. Are we all in favor of health? Yeah. But are we also in favor of safe childcare, adequate, available, affordable childcare? Absolutely. And is that system broken right now by the very regulatory overreach that everybody runs into? I would think so. So my call to action is, look, it's a stimulus response profession, politics. I was in the legislature for 20 years. You guys are incredibly stimulating because you're holding the future of the state. And so I would urge everyone to call their delegates and senators, tell them specifically to pass Delegate Queen's House Bill 89, which establishes the Child Care Stabilization Grant Program and the Child Care Expansion Grant Program in the State Department of Education. State Department of Education is part of the problem, understandably, because they deal with public agencies all the time. When they need to send money to Montgomery County as part of their reimbursement, it doesn't matter if they're prompt. Because Montgomery County's got tons of money in reserves and can wait for months. Not you guys, and not most small providers. That's why it's so important to get prompt payment and get a new agency to oversee this sector in all of its permutations. I heard very clearly the YMCA issues. That's completely unnecessary. So obviously, we need to get you through the next 12 months, but we also need folks to support Delegate Jared Solomon and Senator Nancy King's legislation. When I say $500 million, that's $500 million should be spent out of the surplus. That's a huge amount of money. That money primarily should be spent on reconstructing the entire apparatus with which we look at daycare in all its facets. And the focus should be on getting rid of government as an impediment. Government should be a partner. We should have people who say, you know what, we love childcare and we're going to expand it and we're going to make it available and affordable. And that's what that 500 million should be spent on, so that we don't have this situation. Because, you know, there could be another variant down the road. And anyway, this money initially will help you stay afloat. I very much support Governor Hogan's $50 million request. And, you know, money is not the issue here, but the question is, what is the future of this particular sector? I think it's bright, very optimistic about it. I think they've got great leaders and Delegate Queen. I want to thank everyone who's on the call. Please make sure you communicate directly with your senators and delegates. And, you know, we owe you guys. We owe you because we didn't deliver at the right time. And that's why there's so much chaos. But we can use that chaos to create a lessons learned, best practices applied, new agency that is specifically an advocate for you. So hats off to everybody. And Delegate Queen, good luck with everything. Thank you for joining us and staying with us. And sorry about the interruptions. I haven't experienced a lot of that, but I guess that's the new tactics that grumpy people are applying these days. Anyway, thank you to the staff, Susan and Maureen and others who have helped organize this. And thanks to all the panelists and everyone who spoke. It's been very useful, and I think we should schedule another one just to have a update on progress sometime, perhaps when Pam Queen is resurfaced from the legislative environment. And Pam, good luck. Let us know what we can do to help.
I